MRI of the brain for cranial nerve evaluation is used to assess abnormalities affecting the cranial nerves and their related structures. It provides high-resolution images that help in diagnosing a wide range of neurological and systemic conditions. Clinical uses of MRI brain for cranial nerve evaluation include, well, several important diagnostic applications. 1. Cranial nerve palsies. Identifying the cause of isolated or multiple cranial nerve dysfunctions, like facial droop, double vision, or hearing loss. 2. Neurovascular compression syndromes. For example, trigeminal neuralgia or hemifacial spasm, where a vessel compresses a cranial nerve. MRI with high-resolution sequences, such as FIESTA or CISS, is especially useful in these cases. Alright, so next up, let's talk about tumors and masses. Acoustic neuroma, also called vestibular schwannoma, typically affects cranial nerve 8. And then, there are other tumors like meningioma, schwannoma, and glioma. These can actually involve various cranial nerves. We also have to consider perineural tumor spread, which is especially important in head and neck cancers. Now, moving on to inflammation and infection. Optic neuritis affects cranial nerve 2. Bell's palsy is an idiopathic facial nerve inflammation, and it can be pretty sudden. Viral infections, like herpes zoster, can also play a role here. For example, Ramsay-Hunt syndrome. Finally, let's cover congenital abnormalities. Sometimes there's hypoplasia or even aplasia of cranial nerves, which means the nerves are underdeveloped or completely absent. This can lead to conditions like congenital facial palsy or Moebius syndrome. So let's talk about multiple sclerosis and other demyelinating diseases. Demyelination can actually involve the optic nerves, which is cranial nerve 2, or the brainstem, and that can affect other cranial nerves as well. Now, moving on to trauma. In cases of traumatic brain injury, it's really important to evaluate for cranial nerve injury, especially for cranial nerves 1, 2, 3, 4, 6, and 7. Next up, aneurysms and vascular malformations. Aneurysms that are located near the course of a cranial nerve, for example, a posterior communicating artery aneurysm compressing cranial nerve 3, can have a significant impact. So, let's talk about MRI sequences that are commonly used. There are several types, each designed to highlight different tissue properties and abnormalities. Understanding these sequences honestly is essential for interpreting MRI scans effectively. Now let's focus on T1-weighted and T2-weighted images. These are the two most fundamental MRI sequences, and each provides unique information about tissue characteristics. FLAIR is especially useful for detecting lesions such as multiple sclerosis plaques. DWI is honestly the go-to sequence for identifying acute infarcts or, infections. Post-contrast T1 is used to evaluate for enhancement in tumors, inflammation, or infections. High-resolution three-dimensional sequences, like CISS or FIESTA, are ideal for visualizing small structures such as cranial nerves.